Welcome to the Lion's Den, a place you will find men just talking. This is the 5th episode of Season 2. I hope you had a chance to review the first 3. The 4th will be out shortly. In the past episode, I was blessed with the appearance of a holistic practitioner and a fitness coach. There was some valuable information provided. It's a must-see. If you haven't checked it out yet, please do. The title was Motion is Lotion and Exercise is Medicine. Today I have with me Dr. Mitchell, a urologist. Dr. Mitchell, please introduce yourself.
Hi, I'm Chris Mitchell. I'm a urologist by trade, which means specializing in urologic disorders, urinary tract, and primarily my focus is treating men with cancers of the urinary tract.
Great, thank you. All right. Please remember to like, share, and subscribe. I'm your host, Renard. Dr. Mitchell, you weren't my original doctor. When I was diagnosed, after my PSA levels were up in the biopsy, they gave me a couple options. Radioactive pellets was one, and the other was prostatectomy, which I chose, but that came with options. And that option, was evasive, where it opened my stomach and removed the prostate, and the other was robotic, where your specialty was, and I was referred to you. And I must say I've been pleased. What led you down the path of urology?
When it comes to urology, why most of us go into it, it's not because we have any, affinity towards the urinary tract. As a doctor, it's a really cool field where you get a really nice mix of surgery from cancer operations, like in your particular case, and there's a lot of small office-based surgeries. There's everything in between. The variety is huge. For anyone with a really technical mindset in terms of surgery, this kind of gives you the opportunity to do all sorts of cool surgeries with a lot of minimally invasive technology, obviously, to help patients. So most of us, what draws us in is kind of the types of operations you get to do, and then you learn to really feel passionate about the urinary tract, and once someone's been affected by a condition of the urinary tract, they realize how important urologists are.
Yeah, absolutely. So this wasn't a family path? No. Yeah. And so how did you get into robotics specifically?
For me, I think it really is interesting. I have a very three-dimensional mind, that way that it works. I can kind of think in three-dimensional space. And what can really separate people within the field of robotics is those people who can really understand three-dimensional relationships and be able to sort of operate, with small all incisions meticulously, but approach it in a three-dimensional way that, you can get through the operation in sort of, a different way that we would look at it when you've got the tissues in front of you. You can touch them, feel them yourselves. You kind of have to be able to think how you can approach getting this done without feeling. When we do robotic surgery, our hands are not in the patient. We're doing a lot of things by visual cues and, visual feedback rather than tactile or feeling feedback.
Okay. Yeah, but I remember seeing you at a volleyball club when my granddaughter was playing. So is your kid still playing? Or?
Yeah.
Okay.
Yeah, so my daughter's still big in volleyball. Season's actually getting ready to start this week. So
is she's not still playing at the same club, or?
She right now she plays for she's doing the CYM league, so she's at St. Mary's, and then for travel volleyball she's been part of DU, Delaware United.
Okay. I heard that one's pretty hard to get into.
Yeah, very it's intense.
Yeah,
for sure.
Oh man, so you need to know someone then. During my recovery, I was part of a clinical trial.
Yes.
And so what made me a good candidate for that clinical trial?
I think, when clinical trials come around, they're trying to answer a question in medicine that we don't, have the exact answer to. And the best clinical trials are generally giving patients 2 good options and trying to decide which one's best. So in your particular case, it's trying to say, we know how we have done it in the past, and it works, but can we do it potentially better, or can we do it with potential less side effects? So when you have a question, where the answer is not obvious, the only way to get the best answer is with a clinical trial where you take half of a population of men, or not, doesn't have to be men, but in your case is all men, and you provide them with an intervention, and you give another half of men, randomly assign them to a different intervention. You study them, and then years later you get the results so that we can shape the future care of men.
Right.
And that's basically how you're a good clinical trial candidate, is there has to be an unanswered question, and then you have to fit the parameters for who may be able to help get us those answers in the future.
Okay, good. No, I actually thought it was great to participate because, and the way it was explained to me earlier is that it may not help me, but it'll help someone else.
Correct.
And I thought that was a good thing. At least, we'll get somewhere. I mean, like I have boys.
Correct.
So, at least if it helps me, it could help them in the future, which is great.
I think one of the other things about being a part of a clinical trial, and this is pretty well studied as well, that men and women who choose to be a part of a clinical trial actually have better outcomes overall. You'd say, why is that? Especially maybe if you're getting a treatment that maybe wasn't you might be getting the treatment that's not the best, but you'll still have a better outcome. Why? Because as part of a clinical trial, you get a care team that helps ensure compliance, so it helps make sure the patient's getting the care that's been prescribed. It gives you resources to adapt to side effects. So it opens up a whole bunch of more resources that maybe someone that's not in a clinical trial wouldn't have readily at their disposal. So we always advocate, within reason, if patients are candidates for clinical trials and the trial makes sense, that they consider, because in the end, we know that their outcome tends to be better.
Right. It's good. And then another thing you did for me, because, when I think about this process, I think of all the things that happened. You uncovered that my cancer was aggressive. So my insurance wouldn't cover the testing for that, but you guys put it through for me anyway, which was really good. Then it came back because I was blaming my dad for giving me prostate cancer, and then the answer comes back and it wasn't it wasn't genetics. I'm like, man, I can't blame him now.
So we know there is a genetic component of prostate cancer, and not all genes that we can study, we really understand. We know the major ones, and didn't have any of those, but obviously we know that there are tons of genes that do things that we just haven't yet figured out, and they're probably what are responsible for these men who we think there's a hereditary component, but we can't prove it with one specific gene.
Yeah. So I had Dr. Rabin
Yes,
and Dr.
excellent.
Master on my podcast.
Oh, great.
Yeah. So that was pretty good. Some very valuable information came out of it. And Dr. Rabin, he recommended 2 books. He said, if you're going to do this, then check out these books. The one book was called Outlive by Peter Attia, and the other was Super Ager by Eric Topol. Now, Super Ager was very technical, so
Okay.
I'm like, but he referred to Outlive, and Outlive, I got to say, it was Peter Attia. I think his delivery was pretty good, and what I read, I was able to understand. But one of the things he talked about was actually medicine going into more of a holistic approach, where like the mind, body, and soul, and prevention. Like he talked a lot about genes and so on, understanding the genes, and that's how we could help to make society better, or live longer, or healthier. What are your thoughts there?
I mean, I think Dr. Rabin and I are close, colleagues and friends. And one of the things that, even though we treat cancer from completely different, him being a radiation doctor, me being a surgeon, we believe truly that, there's a lot that we can impact beyond just the cares we provide. And this is the sort of holistic lifestyle. Men eating healthy, men exercising, men sort of, making sure that they know what they're putting in their body. These things not only help you live longer in terms of just overall health, but they also have been shown in some trials coming out now that, men like maybe following a Mediterranean diet, men exercising 3-4 days a week actually have better outcomes from cancer. And I think this is one thing that we recommend all of our patients, whether they're choosing surgery or radiation or sometimes needing both. But man can affect their outcome equally as to what treatments that we can offer.
Yeah, that is true, and I find that to be true because I mean I feel a lot healthier, and Dr. Rabin also early on recommended a Mediterranean diet, which
Yeah.
now I'm not going to say I'm 100%, but I do try it.
I think we're all humans at the end of the day, and what I tell people, my patients, is find components of that diet that you can incorporate.
Yes.
It's not something that you're going to say, you're going to take what you've been doing for the last 30, 40 years of your life and all of a sudden change it. But if you can incorporate some of those aspects, some of those concepts into your life, it can only make you healthier.
Yes. Yeah. So in my last podcast that I talked about earlier, we talked about exercise, which you just said, and one of the catchphrases was "motion is lotion." But then there's a segment of us that can't move. So what could they do? What avenues could they use to sort of get themselves in better health?
I mean, to me, I think that you can find a type of activity that your body can handle. I mean, it might not be, you may not be a swimmer, you may not be a marathon runner, but there's plenty of good exercises out there. Yoga, for instance, yoga can be amongst the most intense, or at least intense activities, but it's good for your core, which for a prostate cancer patient is important. Core muscles provide a lot of aspects of your urinary functions. So yoga, Pilates, I think anything that you get your heart rate elevated with, for over a sustained period of time. If you can't walk, can you get in the pool?
Yeah.
Can you do pool aerobics? I mean, there's creative ways of handling this. I just had a patient I did surgery on probably about 10 years now, and as he aged, he started having more side effects, in terms of urinary issues. And he came back to me. I hadn't seen him in a few years. He lives in Florida most of the year. And he came back and he's like, you know what? My wife decided she had an injury that she needed to rehab. She got a trainer. And, this is a guy in his mid-70s now. He's like, I just have gotten hooked on exercise. He's like, all the issues I had, are gone. So it's like all these things that I was asking, for medications to solve, I solved with exercise.
Exactly.
And this is a guy who had a lot of limitations of what he can do, but he worked with someone that helped him find exercise that he can do, be safe. He's like feeling great. And again, a lot of the issues he was having, he's like, I came back, he's like, yeah, they're gone. I mean, we're good. This is great. So.
Yeah, and the fitness coach that was in the last podcast, that's what he said. He said, you get yourself moving, whatever it is, just get moving, and then eventually you'll be able to do more. Eventually, more.
Exactly right. I mean, you find what works for you and build off it, and you'll feel better. You'll be healthier. Again, a lot of the issues that we all might suffer from might vanish. You know what I mean?
Yeah.
It's not a cure-all, but it certainly does help a lot.
Yes. Now, I was 55 when I was diagnosed, and I went through all of this. Now, that's a younger age. Now, are you seeing more younger patients now coming in?
So, one of the unfortunate realities of being a urologist right now is we are seeing a lot more aggressive prostate cancer affecting younger patients. And the reason's not entirely known. There's a few theories. One of the theories is that for a long period of time, around a decade, there was some changes in the United States Preventive Task Force recommendations that leaned away from prostate cancer screening. And so for around a decade, men were not getting checked regularly. And because of that, when men are actually now presenting their disease as being caught at a later stage, the task force has went back and reversed the recommendations. but unfortunately, we're still feeling the effects of that.
Right. Okay.
Anything decision that's made with prostate cancer has a lag of like 5 to 10 years. So it's one of those cancers, given its relatively slow-growing nature, even though it can be aggressive and life-threatening, it takes a long time to get to that point.
Okay.
So you don't really see the impact of your decisions when you make a recommendation on screening, for instance, or even treatment
Right.
for years later. So you have to have patience when you study prostate cancer in terms of making overall decisions or recommendations. But that recommendation clearly affected a lot of men in terms of late presentation. The other thing that's thought and being tested is that, because of the changes to our diet and the more sedentary lifestyle, that this is leading to metabolic changes that are allowing prostate cancer to develop earlier and also reach more aggressive forms. So these are kind of the two leading theories, but the point is clear. We're seeing younger cases regularly, and we're seeing more advanced cases regularly, such that, we've got our work cut out for us in terms of keeping men, free of disease in the future.
Yep. And I remember in our last visit, you would we talked about, when I told you about the podcast. You said you'd love to be on because you're an expert in the area, but you also told me about 302, the prostate bill that was in office.
Yes.
Has that? I know 25 was supposed to start. I was negligent. I didn't go back in and see where it is at this point. So has a whole bit on it, or it's being rolled out?
Yeah. So the bill I think you're referring to is the bill to make sure that prostate cancer screening is covered in Delaware.
Yes.
And my understanding is that bill is moving forward, and for men in the future, all prostate cancer screening will be covered regardless of insurance status.
Right.
So if you're not getting checked, we don't know where you're missing.
Yes.
And so the one thing message out for all men who are, the guidelines currently, and I would agree with these, 55 to 70 and healthy men should be getting checked, for prostate cancer. That's really where we see the biggest impact in terms of identifying and treating cancer to extend life.
Okay. When I was going through, I didn't have symptoms that I knew, because the way it was found out is a PSA and then later a biopsy.
Correct.
So is that common?
Correct. Yeah. So prostate cancer, typically asymptomatic in the most treatable stages. So one of the problems is that if man's coming to me with symptoms of prostate cancer, it's usually advanced, and this is usually a cancer that's going to either not be curable or going to take multiple different treatments to cure. So ideally, we catch men who aren't having symptoms of prostate cancer, because that's usually where it's a localized form, can be potentially treated with either surgery or surgery plus radiation, depending on the exact aggressiveness of the cancer.
Okay.
So, that's why, I see a lot of men that say, I feel fine, I don't need to get checked, or I don't have anything wrong because everything seems to be working just fine. Well, unfortunately, that's not the reality. Unless you're getting checked, you don't know if you're fine.
Right. And see, and what I did, and I just did this throughout my life, is every year I go and get a physical, and that's how that was uncovered, and that's kind of the message that I send out to everyone that hears my voice or listens. Go and get checked, see your doctor.
Correct. There's reason that these things are recommended, and the point is that they're trying to keep you healthy, trying to keep you the best version of yourself.
Right.
And with prostate cancer, it's a silent killer. You don't unless you're checked, you're not going to feel much until it's really, really a major problem.
Okay. And what are those symptoms? What?
So men that present with advanced forms of prostate cancer can be having a lot of local irritation to the bladder from cancer that's really advanced, causing blockage so they can't pee. We also see men presenting with metastatic disease, meaning cancer that's already left the prostate. Prostate has an affinity for bones, so a lot of these men will come in with bone pain. I got this aching spot in my hip or my back, it's just getting worse, it's not getting better. I've tried rest, I've tried heat. Oh boy, someone checks a PSA, it's way out of control, this is prostate cancer. Other place that prostate cancer tends to travel to is lymph nodes.
Okay.
So man might come in with, having swelling or, having, again, kind of a aching pain. They get some images, they see enlarged lymph nodes causing kind of compression or irritating other things around it, and that's
Right.
why men are having the symptoms. As you can see, these are not the way you want to be diagnosed with prostate cancer.
Yeah.
The best way is if it's contained within the prostate. You can have prostate-directed treatments, radiation or surgery, and with a high probability of cure.
Yes. Now, and I want to just go back once to the radioactive pellets being inserted into the prostate, but the prostate is still in the body. Now, my mind tells me because it's still there, it still can cause an issue in terms of like seepage and so on. Am I off base?
I would tell you that the data is pretty clear. Surgery and radiation provide equal cure rates. So I would say, the success of treatment is equal. One of the advantages of surgery, and I think you're a living testament to this, is that if you start with surgery and cancer can return and need more treatments, you still have radiation as a backup. If you start with radiation and the cancer has not been fully eradicated within the prostate, we don't go back and do surgery because of the scar tissue that's left behind by the radiation. So for those men getting a cure after they've had radiation, cancer persists, can carry a lot more risk because we don't do surgery. The current standard is to add more radiation to the prostate, but the tissues can only handle a certain amount of radiation before really bad things can start to happen. So, one of the things we think about with younger men is surgery first. A lot of guys are cured with surgery alone only, never needing anything else. But then more aggressive cancers might need different additional treatments down the line. We can selectively add radiation, like you and Dr. Rabin.
Yes. Yeah. And I know I didn't have the technology behind it or the science behind it, but it didn't sit well in my mind. I'm like, man, I don't think I want that.
And there are some people that I tell them the cure rates are equal, but conceptually they feel more comfortable knowing that it's been physically removed than, radiation, which kills the cancer in place.
Yes. Okay. Now, in the past 8 years, I know there have been several advances in the robotic field of the robotic science.
So, there's been advances to improve the visualization of the robot. So if you can see better, you can do better surgery. The instrumentation has gotten smaller. It's gotten, even more dexterous. We call it ability to recreate what you can do with your hands. We've expanded the number of operations being done robotically. So even 8 years ago in urology, we were always kind of ahead of the curve in robotics, but now you're seeing it move into other fields, general surgery, cardiovascular, heart surgery, lung surgery, so robotic surgery is definitely pushing into more fields where we can see the same benefits we saw with, urology, smaller incisions, less pain, quicker recovery, less side effects.
And those are the things that you get from that because I know if you cut it open, it's the air can actually cause issues in terms of spreading.
I mean, that's a common theory. Truthfully, it's never really been proven.
Oh, okay.
But there's no question that when you open the body up to the outside world for long periods of time, that slows man's or woman's recovery down.
Okay.
You get exposed to more potential bacteria. You have, more fluids that shift out of the body. So it really has to do with the recovery of the patient. When you study it, cancer control between robotic surgery and, at least with urology, and open surgery are equal. So that would kind of say that it's probably not this, the air feeding the cancer theory. But what's definitely clear is the recovery of someone who had robotic surgery and someone who had open surgery looks different. Man feels better quicker, they bounce back quicker, they're doing their activities that they enjoy quicker, and often with fewer long-term side effects.
Okay. Now, also, the medicine has changed as well.
That is huge.
I tell you, that was an undertaking.
So one of the big things, as it's kind of a curse and a blessing with seeing more advanced forms of prostate cancer that we are now. But it's also, because of that, there's been an explosion in funding for advanced prostate cancer. So, in the last 8 years, we've probably had 5 or 6 new treatments for advanced prostate cancer approved. A lot of these are medications, that act by blocking some sort of testosterone production or the body's ability to respond to testosterone. But now there's also newer treatments coming out. We kind of generically call them theranostics. But one you'll see if you're watching, the sporting events they're advertising, it's called Pluvicto. And this is actually, targeting a form of radiation to a molecule that binds selectively to prostate cells. So it's given as an infusion, and this molecule PSMA will bind to this PSMA only expressed on prostate cells and then deliver a radioactive particle right to the site of cancer. So these treatments are new. They're now an option that we have to offer to our patients that did not exist just a few years ago. So there's been a ton of great research, a ton of new medications. We can keep patients alive and functioning well, far beyond when I was started, into this field.
Okay. Oh, good. That's great. Now, funny you mentioned a commercial. Well, I started in a commercial like Christiana Care, and it was actually with Dr. Raven. Oh, you saw it?
Yes.
Oh, okay. Yeah. I found out I had prostate cancer, and it was devastating news. I was only 55. Christiana Care gave me options. I had a prostatectomy and radiation.
At Christiana Care, we are utilizing innovative technologies to deliver very precise radiation therapy like CyberKnife and VMAT to improve patient outcomes. But great care always starts first with compassion and understanding.
Dr. Rabin and the team made me feel at ease and explained everything in a way that I can understand. They were so kind and caring. I decided to be a part of a clinical trial because I knew it would help others.
Clinical trials can improve outcomes by offering patients access to advanced technologies and treatments that they otherwise would not be privy to at Christiana Care.
I am now on a crusade to get the word out. I created a podcast called The Lion's Den to share stories and talk about important men's health issues. Best advice? Go to the doctor. Get annual physicals. This could change everything, as it did for me. I am now 63 and I feel great. Nothing is guaranteed, but we're all in this together. I'm glad that I had the Christiana Care team there when I needed them most. Okay, and one of the things that really intrigued me is the CyberKnife, because I asked him the same question, what advances happen in radiology? And he was telling me about the CyberKnife.
Yes.
And I went in the room and saw this thing. It's massive, but like, man, someone can actually, figure out how that works. But so how does that cross over into your area? Or?
So the cool thing about CyberKnife is just like robotic surgery. It's finding a way to do what needs to be done more precisely, and that's really how robotic surgery has benefited men. Well, the CyberKnife can target the boundaries of the prostate or any cancer more specifically than standard X-rays. So it can do what it needs to do with fewer side effects. The side effects are, though, at the end of the day, the same. Largely, the candidates who are good candidates for radiation are good candidates for CyberKnife. Those who benefit from surgery should probably have surgery. So it's another tool that we have, but it doesn't really, it's not like it has said, well, we're taking patients that used to have surgery and using CyberKnife on them, or vice versa.
Okay.
They each have the patients who benefit the most from them, and that's still who's getting those treatments. But again, it's just a way of doing what needs to be done for the patient with fewer side effects.
Okay.
And in CyberKnife, even more convenient. It's taken what used to be 6 weeks of treatment down to 5 sessions only, done over 2 weeks.
Okay.
So for a patient, a much more convenient way of having radiation treatment. Instead of 40 sessions, it's only 5.
Now, CyberKnife. Now, I'm thinking of the term knife. It's a slicing?
No. So, as with a lot of these things, there's some cool technology, but there's some cool marketing. There's no surgery involved in CyberKnife.
Okay.
So it's purely marketed, and their thought, is to say we're delivering radiation with surgical precision.
Okay.
So that's kind of how the CyberKnife
Okay.
comes about. But there's no cutting. It's just X-rays being passed externally to the prostate.
Yeah, I am thinking it's like
No.
a laser beam going in and just cutting stuff.
So even with the robotic surgery that I do, called the Da Vinci robots, and again, just a really creative name.
Okay.
But at the end of the day, it's just a tool.
Okay. Any final thoughts for my audience? For our audience now?
I mean, I would tell you that the biggest thing with prostate cancer is, guys especially don't like to talk about these things. And the one thing I hear back from my patients commonly when they've been diagnosed and they're more open to sharing it, they find out how many men, their friends, their families, people they go to church with, their coworkers who have been affected by it.
Right.
And again, men just aren't good about talking about their health. They don't want to show signs of weakness that they had to go through a struggle. But with prostate cancer, talking about it and having people get checked, you've dealt with this. Say to your buddy, hey, have you been checked? Because if you have a problem, the sooner you know about it,
the better.
The smoother your outcome is going to be. And this is a problem with men, more so I think than women. That's just, it's just not talked about. And prostate cancer is incredibly common. It's the most common cancer that can be diagnosed in male. It's still one of the leading causes of death of men in the United States. And the only way to stop that is shift that curve, is have men come in, get checked out. If they've got a problem, let's diagnose it. Let's treat it appropriately if it needs treatment, and let's get you back on with your life.
Yep, exactly. And that's actually part of the reason that I created this podcast, just to get men talking.
Yep.
It's all talking, and just open up a dialogue. And I've been through it. I tell you everything I went through, and and tell you the places I went, the people I saw, and how I am coping with it. And talking is therapy. I had to go to a therapist, but I mean that worked. I'm telling you, and talking is therapy, and that's how I feel and how I cope with this.
Correct. Yeah, I couldn't agree more.
And so you got to, whatever it is, you got to find a way to cope with it. It's not going to take you out unless you allow it. You can't just sit around and woe is me. No. And then I think each of us have to help one another.
Yeah, I mean, we all have the experiences we've gone through can help other people,
exactly.
And the only way that other people can benefit from what we've dealt with is to share it. Share your experiences, share your successes, share your failures. But the point is that, if it's being done with good intent, you're helping other people potentially live better.
Yes, and I always say, knowledge is wasted unless it's shared.
Exactly right.
Okay. Remember, he who looks outside dreams. He who looks inside wakes up. Look inside and wake up for your health. If you don't take care of your wellness, you'll be forced to take care of your illness. I'll say that again. If you don't take care of your wellness, you'll be forced to make time for your illness. Let that marinate. And I'm going to take it a step further. If you don't check in, you may check out. What a glorious day. Remember to breathe. Like, share, and subscribe. I'm Renard. Peace.